Now, welcome back. So, oftentimes you will have request for a product that again is not available. You will have to convert, say, a solid dosage form into a liquid dosage form. Could it be that the patient is not able to take the medication as is marketed? So in this case, you have to now start thinking about individualized dosing. You may not be able to put this in a powder. You may have to just make up a suspension. And so that now takes us to how we alter these products that you have to from the solid form that is given to make this liquid preparation that is needed to treat the patient ailment. Again, you still need to understand the different expression of concentration and what they mean. You also need to understand milligram per cent, parts per million, parts per billion, ratio strength, very crucial as well, and how to use ratio and proportion to respond to the different items. All right. So, in terms of practice and the application of this, you will see this very often. For example, you have a child who is born with a heart disease, for example, and the doctor may write these furosemide suspension, spironolactone suspension. You don't have these things coming in those liquid form, and so you will have to often make them up. All right. So how exactly we go about converting the furosemide tablet and the spironolactone tablet to make the suspension that the patient can take. So when you look at this, we look at individualizing the dosing as well as the formulation so that we can provide the medication in a form that the patient can safely use the medication. It could be that they have difficulty swallowing, or you may have someone who is undergoing radiation, for example. They may having a percutaneous gastrostomy, so that's a tube into the stomach, and the medication must be converted from tablet into liquid. And when it's converted to liquid, they can add that to the tube that goes directly into the stomach. All right. Could be that you want to improve the palatability, the taste of the medication. The medication is bitter, so you add a sweetening agent or a flavoring agent. Or you want to increase the absorption of the medication. Or dosing flexibility. So we talk about measuring doses as well. And a lot of these times you will see these prescriptions, they'll come to you ever so often. And so you must be familiar with this concept where you need to make up a suspension for the patient that you may have before you. Some things that you need to consider, you're making a suspension, you might need a suspending agent. You might need a preservative depending on the prescription that you're making up. And then you may need a flavoring agent or a sweetening agent for that prescription as well. There are some other things that you will need to consider as well, but for the purpose of making suspension, we will just look at these specific ones that we have here. So we're going to look at the suspending agent, the preservative, the sweetening or flavoring agent, and the vehicle. In this case, we're going to be using boiled cooled water as a vehicle. Now, you have a prescription for terbinafine suspension, 165 milligram per 5 mil. The first thing that you need to do is to interpret the prescription. You need to look at what stock you have available as well and how many days of the prescription you're going to be supplying. So the first thing, 165 milligram per 5 mil is what I need to give, but I know that in my stock I only have 125 milligram and 250 milligram tablets. So I know I need to make up something here to give this patient this 165 because there is no way I can give the 125 or 250 such that the appropriate dose is maintained for the child. All right. Tablets, the prescription also says liquid. It says 5 mil, so it means that I need to make a suspension. All right. Now, it says Mite 6/52. The other thing I need to understand is that I'm not able to make a stable suspension for 6 weeks. And so I will need to make for 2 weeks at a time, and this is acceptable. So for liquid preparation, I'm going to go with 2 weeks at a time. If it is that it's a semi-solid or solid, then I can make up to 4 weeks at a time. All right. All right. So just remember these whenever you see problems like these. All right. Now, we established that we're going to be making 2 weeks or sending 2 weeks at a time. So the patient or caregiver needs to come back to the pharmacy within 13 days for you to make another 2 week supply of that medication. So that is what we have established here. Now, we are going to be compounding for 2 weeks. We need to determine the amount of drug that we're going to need for the first 2 weeks of the prescription. So how we calculate that, we're going to look at the dose, which is 165 milligram. What is the frequency? It says OD, which is once a day. And the duration that we are going to be sending it for is 14 days. You work that out, you're getting 2,310 milligrams of medication or 2,310 milligrams of the active drug that you need for the 2 weeks. Now, the next thing I'm gonna do here is to determine which of the available stock I have. So I don't have cost, so I'm not gonna take that into consideration. I don't know the cost of the tablets here. It just tell me 125 and 250 milligrams. So I don't know whether the 125 is cheaper to use or the 250 is cheaper. But what I can do here is to prevent wastage. And so to prevent wastage, I'm gonna divide through to find out which of these will give me the exact amount or closest to 2,310 milligrams of medication for 14 days of compliant therapy. Once I divide that out, I realize that the 10 tablets for the 250, because I can't use 0.24 of a tablet, I have to round it up to 10. I realize that is taking me to 2,500. If I do 19, which is 18.48, can do 0.48, so I round it up to 19. It's closer, 2,375 is closer to the 2,310. So this is the value with least wastage. So I'm going to be using the 125 milligram tablets. Now, I need to first determine the volume of suspension that I'm going to be making up. All right. So what does that 19 tablets that I'm going to be using equal to? So that is a 19, multiply that by 125 milligram, and that is equal to 2375 milligrams, right? So now how much suspension am I going to put this into? So I know I want a dose of, I want a concentration of 165 milligram per 5 mil, and that is the first part of the proportion. If it is that I'm using 2375 milligrams of medication, this is now going to form the second part of the proportion. What volume am I going to be putting this into? And you work that out, you will get 72 mils. I now need to determine the quantity of the other ingredients that I'm going to be using. So for the tragacant, it tells us here in the question that as a suspending agent, I can use 0.5 to 2% as a suspending agent. And so here, once you work that out for the tragacant, I decide to use 1%, all right? So I use 1% instead. You work that out in terms of the final volume of 72 mils. So 1 gram in 100 mil, that is what that 1% means. You determine how much you're going to have in the 72 mils and you get 0.72 grams of tragacant. For the sodium benzoate, it told I need to look at what that range is for preservative. All right. And so it tells me I can use 0.1 to 0.5% as a preservative. And so how much of this will I need to put in the 72 mils to make sure that I have the adequate amount to preserve the suspension? I use 0.2%. So 0.2% would be 0.2 grams in 100 mil. You work that out, you get 0.144 grams. Now, This gets a little bit tricky because guess what? I have a 10% sodium benzoate stock. And so I need to now find out how much of the 10% stock will give me the 0.144 grams that I need for my preparation. And so here I know I have 10% stock, so 10% or is equal to 10 grams in 100 mil. So in order for me to get 0.144 grams, I need to find out how much mils that is going to be in. And it's telling me here that I need to add 1.4 mils of the 10% sodium benzoate to the 72 mils preparation. Work out the syrup. 10 to 20% is used as a sweetening agent. And so I chose the middle ground, 15%. Once I work that out, I get 10.8 mils of syrup. That is what I'm going to be adding. And now I know that I'm going to be making 72 mils of suspension. I'm going to be adding 0.72 grams of tragacant. Sodium benzoate 10%, I'm going to be adding 1.4 mils. And for the strawberry syrup, I'm going to be adding 10.8 mils to sweeten. What is the other ingredient that I'm going to be adding? This is going to be the diluent, which is the boiled cooled water. And so I can now write my compounding formula as is. Terbinafine suspension, which is the name of the preparation that I'm making. We know that the concentration is 165 milligram per 5 mil because that is what we made it up to. We're making a final volume of 72 mils. We're adding 125 milligram tablets, 19 of those. So we're crushing these 19 tablets and reducing it to fine powder, right? And then we're gonna be adding the tragacant gum. So we weigh out 0.72 grams or 720 milligrams of tragacant gum. You add that to the tablet powder, mix it out until it's evenly mixed. Now, sodium benzoate, we add this liquid, 1.4 mils. Then you add your 10.8 mils of syrup. And now we have our bottle that is stirred to 72 mils. We're going to add all of that, transfer it, rinse the mortar that we did, mix all of that into with some water, add that to the bottle, and then we're going to make up with boiled cooled water until it reaches to 72 mils. You have just compounded a suspension with a concentration of 165 milligram per 5 mil that contains terbinafine. You can now say to the patient, take 5 mils by mouth once a day after meals for 14 days. And of course, you're going to instruct the patient to return, say at day 13, to refill the prescription for another 14 days. Let's look at another example. So we have furosemide here, 8 milligram per 5 mil. It says 5 mils POBD AC, 8 weeks. So we need to interpret the prescription. What exactly it is that we need. We know we need 8 milligrams of drug. We're going to be giving that 2 times a day. We established already that we can make 2 weeks or 14 days of stable suspension. So we're going to multiply that by 14. It will give us a total of 224 milligrams. How many tablets are we going to use to make this up? So we already know that one furosemide tablet is 40 milligrams. And so once you divide that 224 milligram that you need for the 14 days, you will get 5.6 tablets. I cannot use 5.6 tablets, so I'm going to increase that to 6 tablets. Now I need to know how much the 6 tablets will be. That is going to be equal to 240 milligrams in total that we're going to be using in the compounding of the prescription. Now, if it is that we know that we're going to use 240 milligram, we want a concentration of 8 milligram per 5 mil, we can again set up a ratio that will tell us that if you have 8 milligram in 5 mil, then the 240 milligrams will be contained in the X mil. Work that out, you will get 150 mils, and that is the final volume of suspension that you're going to be making. Calculate the other ingredients. So the tragacant gum, for example, We know that we can use a concentration of zero point 0.1 to 2%. And for this one, we use 0.8%. And so once you work that out, you will get 1.2 grams of tragacant that should be added to the final preparation to be used as a suspending agent. Sodium benzoate, it's available in the stock as 10% weight in volume. Okay, now how much of it are we going to be adding to the 150 mil? We need to work that out. So once you work that out, we said, okay, we're going to use 0.1 to 0.5. We chose 0.3% to use as the suspending agent. So we went to the middle ground here. And once you work that out, it says, okay, we need to add 0.45 grams of sodium benzoate. How much of the 10% stock is going to give us this 0.45 gram? We need to work that out. Once you work it out, you get 4.5 mil. All right. And in terms of the syrup, how much of it? 15% using the middle ground. 15% multiply that by the final volume of suspension that you're going to be making. You will get 22.5 mils of syrup that is to be added to the suspension. You can go ahead and write your new formula so you know that you're adding 6 tablets of furosemide, 1.2 grams of tragacan, sodium benzoate 10%, you're adding 4.5 mils of it. Strawberry flavored syrup, you're adding 22.5 mils, and then you're adding boiled cool water up to 150 mils. Any questions that you have, feel free to reach out to me. I'll be happy to respond to your questions. Thank you.